Greetings. I am Melinda Taylor with Lafayette Habitat for Humanity and also the co-chair of the Acadiana Housing Alliance. And I'd like to welcome you to the joint meeting regularly happening every other month between ARCH and the Acadiana Housing Alliance.
One more person? Yeah, would have been a lot less.
And I'm going to just quickly ask that anybody who's not speaking, please put your phone on mute. We're getting some background noise, and Elsa may be speaking if you could do that. And as you have something to say or a report to give, please just unmute yourself. But everybody's on global mute right now, so we won't get background noise. And again, asking everyone who's just joining us to please put your information in the chat if you haven't already done so. But again, welcome. We thought today, because there has been so much happening in the housing domain over the last several months, and since we last met, that this would be a good opportunity for us to have a global update on what's been happening. We're calling it our first quarter review. So since we have a lot of ground to cover, I want to go ahead and kick that off. We'll have a series of reports on different topics, and then at the end of the meeting, an opportunity for people to share information and announcements that you might have. So let's go ahead first off with the update from 232 Health. And it looks like Nika's with us today, and I believe you have some slides, Nika. So if you want to go ahead with your report.
Okay, thank you, Melinda. Hi, everybody. My name is Nika Amir, and I'm with 232 Help. I have been the contact center lead here since November of 2020, and I originally came onto the team right around the time when the stay-at-home order was issued in March last year. So I've been working here for just over 1 year. And I, first of all, want to say thank you for having me, and also thank you to everybody for being here and for the work that you do in the community as well. And so basically, as the pandemic, of course, has unfolded, we have seen just a reduction, a diminishing in the resources that are available in the community. And I know that our focus is the first quarter of this year. I won't spend too much time going over last year, of course, but I do think it's significant because we are starting off the first quarter to this year in a much different situation than when we began the year last year. And of course, that situation has been exacerbated and compounded by the many major weather events that we have had in our region. The most recent one, of course, being the winter storm of 2021 that did affect housing and homelessness in this area. And one thing that I did find significant was that when we started receiving calls from people who were requesting free shelter, there were many more people reporting that they had been living in their cars than we were previously aware of. So that's something that did come to light in the effects of the winter storm. And actually, Elsa has my slides, so if you don't mind switching to that, Elsa, we'll go ahead and get started with our statistics. Okay, thank you. So our top 10 housing and homelessness needs of the first quarter are rent payment assistance. That is something that people are calling for quite a lot. And until the rollout of the emergency rental assistance program in March, we really were seeing a lot of community resources that were unavailable or maybe available on a very, very limited basis. And then another need that we see quite often is the low-income subsidized private rental housing through Section 8. We're receiving lots of calls, both for housing that can accommodate people with disabilities, but also just income-based housing for people without disabilities. So quite a lot of requests for that as well. Now the third one, the homelessness advocacy groups for COVID-19, that is when somebody calls us and specifically requests shelter. That is when somebody is calling us stating that they're homeless and they are seeking shelter. And also the next one will go right in hand with that, the housing related coordinated entry. That is something that that's a need for people who call in, and that mainly is for people who have children or families. The fifth one on the list, again, low income private rental housing. That is also a concern, but we do have some resources that don't fall under the Section 8 program, so that does apply there as well. And then street outreach programs for COVID-19. That is another category that is very closely related to the homeless advocacy groups. And then again, we see Section 8 housing choice vouchers. Next, rental payment assistance due to COVID-19. And then home rehabilitation grants. And that could really mean anything from home repair to maybe making a person's home more accessible, such as adding a ramp or any type of home modification inside that would make their home more accessible if they have a disability. And then last on the list, we have domestic violence shelters. That's not something that we see a huge amount of calls for, but it is definitely something that we have seen an increase in over the last year. So what we really focus on right now is just trying to stay abreast of all of the developments with the emergency rental assistance program and keeping in touch with our community agencies to know what they have available, who are they providing the assistance for. So there's a lot of communication back and forth between us and other agencies because they may have to discontinue accepting new clients for a period of time, or they may have to kind of tighten up on their eligibility requirements. So we also have quite a lot of calls. It's not listed on here as one of the top 10, but it definitely is housing related. We have quite a lot of calls from people seeking utility assistance as well. Now, this did not show up on the report because these needs are mainly unmet, but utility assistance is not unmet quite as often. There are more agencies that can provide utility assistance than rental assistance at this time. So that is something that we do see quite a lot of. And we at least try to work with our callers and explore additional resources, like say if they are ineligible or cannot access rental assistance, we try to problem solve and refer to other agencies that can maybe help with utility assistance to offset that cost. Maybe that way, if they have utility assistance, they can divert some of those funds to their rent or anything else that they might need. And could you go to the next slide? Okay, thank you, Elsa. So our top unmet needs reasons. These are basically explaining why the need was unmet. If the person was not able to access it, if the agency was not able to provide assistance right now. And going back again to what I was saying about the pandemic and the weather events of the last year, we can see that the top one here listed, the first one is agency resources are depleted. So that is something that we come across often, and that's when our specialists take that extra step to try to problem solve with our callers and even encourage them to call back for updates. The second one, no program found to meet need. That one could be possibly someone may be calling about FEMA, and their parish might not be approved for FEMA assistance due to the winter storm, or possibly for something like Disaster SNAP to help with food costs. But again, their parish may not have had access to Disaster SNAP. And other, I know that's very vague, but basically if it doesn't fall into any of these categories that we have listed here, we'll just put other. So let's just go to the next one. And sometimes the caller will say, you know what, I don't want to call here because I've already called them and I am ineligible for assistance with this agency for another 6 months or another year or whatever it may be. So that's why we might mark that off there. Some cases, the agencies may advise us that they're full, that they've started a waiting list. We'll mark that off there. Client withdrew. We'll mark that if the caller may hang up, or a lot of times they don't hang up, the call might just drop. So we have to indicate that this person did not get that information that would connect them with the resource, and that's how we indicate that. Again, client ineligible for services. If a person reports to us that they cannot access this a certain resource, then we'll go ahead and mark that off if they're ineligible. In some cases, there might not just be any financial assistance available, which is another way of saying that the agency resources have been depleted, but this is more financial based. And unable to contact client, that is basically if we're making a call back or a follow-up to a call. And if we're unable to contact them back to provide the information, then we would mark that we've been unable to contact them. And sometimes there may not be an agency that's open within a certain parish to provide assistance for something. Certain parishes, depending on whether they're very rural or whether they are more urban, we'll have a different number of programs and agencies that can help. So depending on where a person lives, they may not live in the coverage area of agencies to be able to provide assistance. And again, that's when we take the next step to really explore their personal resources and explore any additional resources that we might be able to pull up to help them meet their need. And then the next one, no transportation. So that is something that we will mark off, basically indicating that the service is there. The client could possibly be eligible, but they have no way of accessing it. So even if a resource is available and a person is eligible, it still would not be accessible to that person if it requires going to the agency and they have no transportation. So we do mark that off in those cases. Client cannot afford the service. That is very rare. We typically don't mark that because most of the services that we have in our database provide free services or at the very least accept Medicaid, Medicare, and have a sliding fee scale. So that's something that we mark off very, very rarely. And then again, the last one, if the client has used all available services and is no longer eligible for services from that specific agency, we will mark that off. And so these unmet needs, basically, they are going to tell us what the person needs and whether they are able to get connected with the resource. And that may be as simple as a agency calling us and saying, look, we really can't take any more applications until a certain date. Or it may be as simple as the client just saying, you know what, I couldn't access this resource for any number of reasons. And as we have moved into the year, we have actually seen more resources available. The week of March 8th, the Emergency Rental Assistance Program was rolled out in the state of Louisiana. So there were many parishes in 232 Help's coverage area that were then able to begin spreading the word and have people apply for assistance. Of course, with the exception of Lafayette Parish in our region, because Lafayette is one of the parishes that is administering its own funds. So we also have, I would say, about the same amount of agencies that have been providing utility assistance. I would not say that there's been any more or any less come online in the first quarter. That has stayed pretty constant. And when we think about call volume, when I compare all of the weeks that we received calls and the number of calls that we received on a given week, the weeks surrounding the winter storm were much, much higher in call volume, especially the week of the storm and the week after. And that is really significant because I think up until that point, there had just been people who maybe had been kind of making do. And then when they were faced with a situation where it was going to be frozen and very, very cold for a long time, then they really needed more immediate assistance. And so they were calling us and really just trying to locate a place to go. But also we were receiving a lot of calls for people who needed heat in their home as well. So it wasn't just people calling seeking shelter. It was people calling saying, are there any heaters available in the community? Things like that. And we did see people calling for water as well, which started to happen when the pipes started to burst and whenever people started having their water shut off for whatever reason. So we did see some requests due to that. And as people have gotten settled and things have been repaired and everything, we have seen those calls kind of diminish and are really just kind of holding steady at the amount of calls that we're receiving. We're not really seeing a lot of surges or spikes, but we definitely are seeing the housing and homelessness related needs remaining elevated as compared to what they were in previous years at this time. And whenever we do refer a person to a resource, there are a few things that our specialists are trained to look for. So they will kind of assess the caller they will assess the caller's needs, but then also assess whether the caller will be able to access this resource or not, as I was saying. And if it is something that needs to be escalated, maybe we need to reach out for clarification to another agency. We definitely will. So even in the cases where we have these unmet needs, like you see here, we do take it a step further to really try to connect them with alternative resources and really try to problem solve with that person, but also, like I said, keeping in contact with our partner agencies as well. And I'm not sure how we're going to do if we're doing question and answer session or if we're going to wait for questions at the end. Do you know, Melinda?
Yeah, if you have any questions right now for Nika, we can take a couple. We do have a number of other reports, so we probably need to move on pretty quickly. But anybody quickly have a question for Nika? All right, well, I appreciate all the great information. And someone did ask in the chat if the slides will be available after the meeting. And I said yes, assuming that Elsa has them and we can share them. So, but all very good information. So thank you so much.
Thank you.
Let's go ahead then and move on to the report from Jody Ware with Rebuilding Together Catholic Charities of Acadiana about long-term recovery. So Jody, take it away.
Hello, everyone. Okay, as Melinda said, I'm Jody with Rebuilding Together Catholic Charities of Acadiana, and we've been working diligently since the storms to try and help people recover. So at this point, we've had 1,374 requests for services that have come through our system. We have 663 that are complete, needing no further assistance, which means they recovered from phase one triage kind of repairs. So tarps on homes, muck outs, tree removals, those sorts of things. We have 324 that phase one services were completed that we think are going to need long-term recovery. We've started calling all of those folks and getting applications out to them. But sometimes people are hard to get in touch with. So we also have, I don't know what happened there. Okay. So phase one open, we have 90 cases. This is broken down into 47 tarps, 14 trees on homes, 39 large debris removals, and 9 muck outs. If you add those numbers together, it's going to be more than 90, but that's because some people have multiple needs. Now, I know 47 tarps seems a little shocking, but most of those are because the roof is too unstable for our volunteers to get on, or the roof is too steep. And so many of those tarps are things that we cannot do without professionals. We are, in fact, getting new cases coming in. Now that CORE is doing some case management, we're accepting referrals from them as well. So those numbers are fluctuating on a daily basis. We have mailed out 113 long-term recovery apps. These are people that we've spoken to that have requested that further assistance. This month, we've completed 18 complete home assessments, including pictures and work scopes. We have 2 homes that we have completed the long-term recovery work on this month as well. One other piece, as far as winter storm calls, we have only had 3 that we have noted, and we've been able to address those. We expected to get more, but 3 is what we've received so far. In addition, this month, we've done 4 roof replacements, so that's very exciting. So throughout this whole period of time, we've been trying to help our clients that we're speaking to deal with FEMA appeals, which is an arduous process. And we're so excited that CORE has stepped up and is ready to assist these clients so we can do the work that we do best, which is organize volunteers and get rebuilding work done. So we're expecting that in the next coming months to see a lot more production on the other side, on the actual rebuild side. Does anybody have any questions about that?
No.
Next quarter, I'll have some fun before and after pictures for you guys.
Yeah, we need photos of all that.
Yeah.
Also, there is a resource for people that's available in this region as well as Lake Charles to help with freeze-related damage, and I'll share that with you in just a minute in the chat, or I'll talk to you after the meeting. So if nobody has any additional...
Oh, you muted yourself, Melinda.
If nobody has any additional questions for Jody, let's go ahead and move on to our next report, which is the homelessness response work and ARCH. So Lee, do you want to go ahead?
Sure. So in thinking about this first quarter, typically in January, we, as a continuum of care for homeless services across Acadiana, conduct an annual point-in-time count where we survey everyone we can find who is experiencing homelessness, both sheltered and unsheltered homelessness across our area. And that gives us an opportunity year after year to compare the numbers within that population, as well as some demographics within that population. So for 2021, we did conduct we did conduct a sheltered version of that. And we are going through the data quality reviews to be able to finalize that piece of the information. So I don't have final numbers, but the unsheltered version of that was actually waived by HUD this year for most communities across the country because of COVID concerns. And we did do some surveying during January anyway for internal data purposes to try to get a better handle on who and where people were experiencing unsheltered homelessness. However, due to COVID, we were not able to get as many people out into that capacity as normal. And so those numbers we knew did not really reflect the totality of people who were experiencing unsheltered homelessness in our area. And then we had the freeze in February, and that gave us a renewed opportunity to better understand who was experiencing unsheltered homelessness across our region, because we needed to get them all inside to shelter quickly. And so I'm not going to take time to go over too much of the data points from that, because last month we did a pretty in-depth program on that. But so anybody can look back at that. But we did have about 600 households across Acadiana who needed to access shelter during the freezing weather for those days. 600 households, and many of whom had been living in their cars. We did have some folks who had been in housing but did not have heat, or their homes were flooded when the pipes bust. And so some of that 600 included some of that population that Nika was talking about as well. I'm going to give Elsa a second. Yeah, there we go. Didn't have adequate housing during the freeze. And so they're counted in that. Excuse me. Also, as a quick update, we've been since April of 2020 facilitating the process of working with the state to provide COVID non-congregate sheltering to sort of supplement as our traditional sheltering capacity went down in response to COVID. And so the numbers of people that are in that program, we're continuing to help identify housing for that population. But currently we have about 150 households. There's a slide on it. The number all the way to the right, if you're looking at this like a baseball diamond at first base, 159 households in that program still. We have not been able to add new households to that program. Or diligently working to try to identify housing so that all of these folks can exit successfully to stable housing. But this is where that program stands currently. The home base number 5 is the number of households that actually moved into supportive housing this past week. And then, of course, second and third base indicates who's kind of up next and ready to go with paperwork, documents, et cetera, and maybe even has identified units. We are really struggling to identify units that meet the HUD fair market rent rate that our folks could move into. There's just, the stock is not there. And so here's a slide that shows what the rates are. So 1-bedroom units for $790, 2 bedrooms for $901. And as we look at this, trying to figure out how to identify additional units that'll work with us to help get people into housing. If you know anybody who's a landlord, certainly reach out to Arch, and we would be happy to help identify a tenant who could make good use of that home. And we are also working in partnership with public health, especially with the announcement recently that all adults or everybody over the age of 16, depending on the vaccine, is going to be eligible for the vaccine on Monday. We're diligently working to finalize plans to increase access and encourage the population of people who are experiencing homelessness to access the vaccines. And so we have another phone call back this afternoon to try to work through some plans to make that happen. I think I'll stop there.
So does anybody have any questions for Lee? All right, if not, I think I'm gonna maybe take things just a little bit out of order here. I can give a quick update on the Housing Authority. I don't think we have anybody else from the Housing Authority staff on the call today, but since Greg was able to join us from Acadiana Legal Services, I was just thinking maybe you could go ahead and give your updates on evictions and what trends you're seeing with the clients that you're serving.
Sure, that's very kind of you. Thank you for the indulgence of letting me go out of turn here. As you might expect, we're seeing a great increase in the number of evictions. We're also seeing some really creative ways that landlords are trying to get around the eviction moratorium by saying that it's about anything other than non-payment. Because as you may know, the moratorium only applies to non-payment cases due to COVID. The moratorium is currently scheduled to expire at midnight on March 31st, but the most recent information from the CDC, which is who issued the moratorium, says that it's likely that there'll be an extension now that the Emergency Rental Assistance Program funds are becoming available to landlords. We strongly suggested, I guess would be the way to say that those funds be directed and also available to landlords, because they've been without any remedy for over a year now, and being unable to either collect rent or to evict tenants who were living there without payment of rent. So you'll see that the rental assistance program now allows either the tenant or the lessor to apply for those. We recognized in the plans for how the funds were going to be distributed that there were some issues that needed to be addressed. So a group of housing advocates have sent letters to the Lafayette program as well as statewide, the Louisiana program, with concerns about how people with limited access to computers and either limited functional or computer literacy would be able to complete that application process. As you know, more and more things, unemployment compensation, disaster SNAP benefits, Social Security, are all moving as much as possible to online applications. And there's a possibility that that deprives people without those resources of the ability to take advantage of those benefits. There was also no protection in the rollout of the plan for landlords simply taking the money and then going ahead and doing an eviction anyway. Louisiana is one of the few states that allows a landlord to evict someone even though they've done nothing wrong. And they call that a no-cause eviction. And we were concerned that the landlords might take the money that they're rightfully entitled to and then not say that they were evicting someone for non-payment, but just say, there's no cause. I don't have any reason. I just don't want to rent to them anymore. So we proposed a written landlord agreement to accomplish the purposes of the act. And the letter conditions their agreement not to evict the person before they can be eligible to receive the funds. It makes that written guarantee part of the lease contract, and it would say that if the landlord chooses to take this money and still wants to evict someone, they're going to have to go to court and show that there's good cause, that in effect the tenant has done something to break their lease other than simply being unable to pay the rent. There was some concerns about programs wanting to put in documentation requirements that are not part of the Relief Act, qualifications that were not part of the Relief Act, for example, insisting that everyone supply a driver's license number, a photo ID, social security number, copies of their written lease. And so many people in Louisiana don't have written leases and would then be ineligible for the funding. So we raised all of those concerns, as well as one final concern about language access. Most everything that was going out was strictly in English, which deprives Spanish speakers, increasingly a large percentage of our population, specifically in our area, many French speakers, and also in some of the major metropolitan areas, there were concerns about Vietnamese, Thai, and some other Asian languages that were necessary to be translated. So that's in a nutshell what we're seeing, the issues we raised with the rental assistance program, and we're hoping that having raised those issues, they'll be addressed to make the program and its benefits more widely available.
Thanks so much, Greg. I'm sure there may be people with questions for you, but I just want to say the letter that your group sent out, in which our parent organization or our umbrella organization, Housing Louisiana, signed on to, can be made available to this group so you can see the specifics of those recommendations that Greg just went over. And just as an update, if anybody who can speak more directly to this than I can is here on the call, which would be someone from SMILE, LCG, or from Catholic Charities, please feel free to chime in here. But with regards to the Lafayette Rental Assistance Program, there is a meeting this afternoon at 1 o'clock amongst the agencies and LCG Community Development. They're hoping to finalize the rules and the forms for that program. And if they are able to do that successfully this afternoon, it's anticipated that the program will roll out here next week. So announced on potentially April the 1st with possibly assistance starting the following day. So stay tuned on that. And if anybody else can speak to that more directly than I can, please feel free to chime in.
Melinda, I put both the proposed landlord agreement and the letter that went out into the chat. So if anybody wants to download it, you can have a copy there.
Thank you. And not sure to what extent our local program, how exactly they're specifically addressing those concerns, but I think it's been SMILE's practice as one of the two agencies charged with administering this assistance to take in-person applications. So to work with people doing paper submissions who really don't have the capacity to do an online form. So that I think should at least in part address your concerns, but we're all eager to see the final results of the talks that have been ongoing and the program rolling out very soon. So anybody here from SMILE or who can speak to that more, or anybody who has questions for Greg? All right, doesn't sound like it. So thank you, Greg. Appreciate your joining us today. And moving on to the Housing Authority, I also don't see any Housing Authority staff on the call, so I can quickly, as a Board of Commissioners member, just give an update, which is not a whole lot to report. We, of course, as you know, lost our executive director, Ted, who went back and accepted a job in his home city of Pueblo, Colorado. So our interim executive director is Lydia Bajeron, and she will continue to do the job until a search begins, and one has not begun as yet for a new executive director. So she is the interim. And renovations continue through the RAD program to the Simcoe and Moss developments, which will now be known as Cardinal Gardens 1 and 2. That program is basically funding switching those units from traditional project-based to Section 8, basically voucher-based housing units, so project-based vouchers. And so the incumbent tenants will be able to continue to stay there under the new program, but they'll have the ability to elect to go elsewhere with a voucher if they choose to. So, and the renovations they're a gut rehab. So they're taking all those units down to studs and completely rebuilding them with new appliances and systems, and they're going to be really nice while still preserving the character of the existing buildings, which were built in the 50s. So they've been with us for quite a while. And those are being done in pods. So people are moved out of one section and then rehoused in existing units in other developments. And when their units are done, they're moved back in. So that's happening in shifts and will be ongoing this year. So that's a brief update on the Housing Authority. And I believe Catherine Boudreau with Council on Aging is with us. And Catherine, I think you're up next on the agenda for your update. So would you like to go ahead?
Just unmuting. Hi, everyone. So we have moved 10 homeless families into our Woodvale Place apartment complex. And we are working with about 22 people in Woodvale who are really far behind in rent, and we're trying to help to catch them up. Currently, within the apartment complexes that we manage, we do have one 4-bedroom home that is open. We have 6 multifamily apartments that are open, and that's going to be at Woodvale Place Apartments. If someone's looking to move someone in who is experiencing homelessness, they need to email me directly. and we have to get certain waivers to skip that waiting list, and those go really, really fast. So please let me know immediately. And I have one elderly apartment, and it's going to be in Scott. That is available. You have to be 62 or older in order to live there. And then we also have a grant that we're still able to tap into. I have about $12,000 left, and it's for utility assistance for anyone who is 60 and older. And that's probably about it for our housing services through the Council on Aging.
Yeah, thank you so much, Catherine. Does anybody have questions for Catherine? And I don't know if it would be possible if you've got a link or any information you could drop into the chat or just send us afterwards about that last thing that you mentioned, the utility assistance.
I'll go ahead and give you guys my email address. And it's anyone who's 60 or older who is, with the utility assistance, we have some leeway, but we have a grant. There's about $12,000 left. And if they have a shutoff notice, we have connections with quite a few of the utility systems. That way we can send them the payment and they'll stop the shutoff notice. So just give us a call if you have somebody who fits in that category.
All right. Thanks, Catherine.
Great. Thanks.
And any questions for Catherine? All right. If not, I'd like to go ahead and move on to an update from Tina Shelvin Bingham, who helped facilitate our recent listening session that we had for residents. It was part 2 of the Housing Louisiana listening tour that was held on Monday night. So Tina, do you want to just give us a quick update on how that went and the takeaways?
I'm sorry, I'm muted. Hello, everyone. We had a great meeting on Monday with the second leg of the Acadiana listening tour, where we focus specifically on hearing from the voices of the residents within our community and just average citizens who can help speak to the priorities that we need to be uplifting at the legislative level to continue to advance things in housing for our area. So really quickly, it was well participated. We had over 10 people, I believe 13 people actually registered for the listening session. We had some practitioners, some regular folks that had an opportunity to really comb through some of the data that's presented. So Alfredo and Cynthia with Housing Louisiana and Ganoha actually went over the housing data for the Acadiana area and really combed through those things and kind of really got some feedback from folks as far as what they saw and what they thought were missing from that data as well. And many of the things that people described as far as educating the community about the eviction rates and what programs are available for housing, things about adjudicated properties, where different programs are lied, are all things that have been echoed across the state as Housing Louisiana has been hosting these different listening tours. So we're looking forward to, currently we're updating the housing priorities list. And I'm gonna drop the link so you guys can see the current housing priorities that we have from the previous listening session. But then after we get that, the new priorities updated with the new information that we got from the folks who participated in Monday's call added, I'll update you guys with the new housing priorities list. And I'll tell you, it won't change that much. Many of the things that people uplifted during Monday's call were many of the things that were already uplifted during our previous listening calls in 2019 and in 2020. So we had a really good listening call, you guys, really new activation from folks who may not be participating on these calls that we have in our joint sessions with ARCH and the Acadiana Housing Alliance. So I'll look forward to some updates from you, from me to you all in the future as we continue to draft these priorities and develop strategies on how we can get more residents engaged at the table as we continue to talk to our legislators and just, I develop programs for our communities as well. So that's my update, Melinda.
Thanks, Tina. And resident engagement was one of the things that when we originally established the Housing Alliance was lifted up at the first meeting. And Tina is our chair for that particular team. and is doing a great job with bringing more people from the community into these conversations to set priorities. And speaking of housing priorities, I want to yield my time and the rest of the meeting to Elsa Demetriadis with Arch, because she is going to be talking about a meeting that was recently held by the AHA Data Committee. And that's something that we've been needing to make some headway on for quite some time, and have finally, I think, gotten to maybe a breakthrough level of moving forward with the data that we're going to collect and the dashboard to create that will really give us the ability to communicate what the housing needs and what the priorities should be through actual data about our area. So I'm going to go ahead and let Elsa take off with that, and also speak to the survey that Tina mentioned around the housing priorities that will be going out to everybody on this call and everybody who participated in the listening session on Monday night as well. So Elsa, go ahead.
Thanks, Melinda. Yeah, as Melinda was saying, we've been talking for some time about creating an effective dashboard that both could be used internally and externally. And so we finally just decided we were going to meet in person now that we're a little bit more able to do that. And so we met earlier this week. It's sort of an ad hoc data committee, and first really identified why we felt a dashboard was necessary. And the priorities were first that we wanted to simply, track metrics when we get to a point where we're establishing metric goals. It'll be important for us to be able to track that over time. Secondly, allowing us to strategically plan what the Housing Alliance wants to do and focus on. Thirdly, informing the public of those trends and resources or lack thereof. And then fourthly, assist then by using that dashboard, we're assisting in leading development and investment efforts. And so we identified a pretty expansive list of data that we'd like to collect that includes, housing stock availability, eviction rates, info related to blighted or adjudicated properties, code violations, vacancy rates, looking at cost burden populations, and the list just goes on and on. And so right now what we're doing over the next couple of weeks is making sure that the agencies that collect that data would be willing to share it, and then finding out from them how frequently they track that data, so that we can come up with a dashboard calendar, if you will, that most effectively represents and reflects the frequency with which agencies are collecting that data. So is it twice a year? Is it quarterly? Is it every month? What are we talking about? And so we all have our marching orders, and we'll be meeting in a couple of weeks, but really excited. And like Melinda said, I think that there was a breakthrough, and I think maybe just meeting in person really, really helped. So I thank everybody that came. If you're a data person, or you're interested in that kind of work, please let us know if you'd like to plug in any way, or if your organization collects, if your organization collects data regularly that you think would be helpful to share with the dashboard. This works both ways. So shoot any of us an email, Melinda, me, Lee, and Tina, anybody, and we will make sure that you get involved. And then the next thing I wanted to talk about briefly, I want to respect everybody's time, is the Housing Alliance priority survey that was recommended to us to distribute. And so I want to kind of talk about that. It's on this slide, I believe. So they encouraged us to prioritize the housing efforts, Housing Louisiana, and they're different than they were originally. We're in different circumstances with regard to COVID and freezes and affordable housing circumstances, et cetera. So really just trying to look at how is 2021 different perhaps than 2020. And so we have about 50 responses so far. It's anonymous. And so if you haven't had an opportunity to fill it out, I'll be sending that link out. But the top 5 priorities as of today is on the screen. So things that like increasing housing opportunities for displaced households in the region, public transportation, removing outdated legislation that keeps us from creating group homes and other shared living scenarios, investing in sustainable development for quality neighborhoods, increasing affordable developments in proximity to jobs, services, and public transportation, and then creating designated revenue streams for local and statewide housing trust funds. So there's also an other section. So if you see a critical need or a priority that's important to you, or you see should be an important priority to us that's not listed, there's an opportunity to fill that in. So I'm going to send that out. And if you want to answer it and also help disseminate it to other people, it would help us get a bigger view than just, we don't want this to be myopic. So as many people can respond, we're hoping that as many people respond as possible. So that will be in a follow-up email to all of you. And I will also go ahead, let me just say out loud, I'll include that survey link, the slides, and then the number of resources that got dropped into the chat so that so you can have it all in one place. So thank you so much, Melinda, for letting me speak.
Well, thank you for all the work that's being done. And again, I mean, this has been something that we identified from the very beginning of this organization as a really high priority, because it's very frustrating to have a sense that there's a housing need and to feel like you're seeing it on the front lines, but not be able to document it, because it's essential that we be able to do that to really make a case for funding, for one thing, but for setting priorities for the community, for people who do actually plan for the funds that we receive, at least through vehicles like HUD. So for our community development department, and others. So I'm just going to say thanks for all the work that you've done there, and that Tina, who is a mapping genius, also has done a small area data project for the Macomb-Bize neighborhood, where she's the executive director of the CDC, and where Habitat's focused most of our work. Yeah, you walked away, Tina, I saw you. And
I also, Melinda, let me just give a shout out that Tina's maps let us know where this could go and what the possibilities were. And I think that really made us excited about moving forward with this dashboard.
Yeah, and that's one of the things that we hope we'll be able to do on a broader scale, which is what Tina's done in Macomb-Bize, is overlay different layers that visually show where blighted properties are, where adjudicated properties are, a lot of other information about the neighborhood and its assets, and that being able to layer that data into a map is a really compelling way of showing people by area what the needs are and where some of the most critical needs are focused. So there's nothing like being able to see it. And that's one of the things that we're hoping to do for the future as an adjunct to the dashboard. So just a reminder to everybody here that we've got about 5 minutes left. And if you are interested in any of the particular initiatives that the Housing Alliance has undertaken, or if you see a critical need that you feel now is the time to establish a task force of this group to address, please raise that to everybody's attention, either here or by following up with an email, because what we really want to see this group do is move to action. We don't want to just have meetings with a lot of informative updates every quarter or every 2 months, but we really want to start engaging in advocacy and meetings for action. So please let us know what you think. And with that, I'm just going to open the floor up for the remaining 4 minutes of our meeting for anybody who has questions for any of the speakers or observations or announcements about what your group is doing. So Damien just asked for Tina's email, so I'll go ahead and drop that in the, or Tina can go ahead and drop that in the chat. And anybody with questions? All right, everybody's quiet. So Carol says, would love to see concentrated effort. Oops, I just lost that chat. Effort for landlord engagement, which it would be great to have landlords or a group or somebody representing the landlord association here as part of this mix and in the conversation with the Housing Alliance. And Harlan says, please make sure to consider people with disabilities. And Harlan, I appreciate your continuing to raise that to our attention because it's something that needs to permeate all the conversations we're having. And Clancy just asked, is any group assisting with getting people vaccinated for COVID, such as transportation to vaccine locations, et cetera? Anybody want to just quickly chime in on that?
I will. So we don't have currently anybody in the region, any agency in the region that I know of that is providing transportation to vaccine locations at this time. But we do have some people that are working closely with the Office of Public Health to help people to schedule vaccine appointments.
And I'll just remind everybody quickly again that the Acadiana VOAD has been, ever since last year when all of this first started, the Acadiana Voluntary Organizations Active in Disasters has been hosting a call, which is now every other Friday. So tomorrow morning is our next call where we pretty much share information around both the COVID pandemic and all of the impacts that's been having, and now also the disaster impacts from Laura and Delta and what's happening in that area. So you're all more than welcome to join those calls. And if you need the information for the call, I can just reach out to me or to any one of us who participates, which is several people on this call, and we can help you with that. But there's generally an update from the public health unit at those meetings about the upcoming vaccination sites. And that's a concern that we can raise tomorrow, transportation for people who need it to vaccination sites, and see if there's any resource out there for that. And Catherine says, Council on Aging provides transportation to vaccinations. I'm assuming that's for your people over, is there an age limit on that, Catherine?
Yes, for anyone 60 and older, and we go to all areas of the parish. And I'm sure I know every parish provides the same types of services.
Okay.
And I'll jump in. This is Lee with Arch. Many of the folks that conduct street outreach work and or are working with our populations of people that are experiencing unsheltered homelessness or even sheltered homelessness are able and willing to provide some form of transportation to vaccinations once we secure access for that population.
Thanks, Lee. Anybody else with questions or comments? Greg says, I also heard that Medicaid plans offer transportation to doctor's appointments. So, all right, well, I will get up with those who were asking about information to join the VOAD call tomorrow morning. And if there aren't any other questions or comments, I think this meeting is adjourned. So thank you so much for joining us, and we'll be back in 2 months on this same platform, maybe in person one of these days, we'll see. But for right now, Zoom. So see you soon.